Hi, I'm Dr. Tanya. Welcome to Mommy Calls, your go-to source for everything pediatrics. Today's topic is breastfeeding and how do you know that your baby's getting enough? Well, what goes in must come out. So when you're breastfeeding, you want to make sure that your baby is having at least a few wet and a few dirty diapers every day. And don't forget that sometimes a diaper may have both urine and stool. If your baby's not making enough wet and dirty diapers, make sure you let your pediatrician know. In addition, when you're breastfeeding your baby, take a look. Not only is it fun and cute and great for bonding to be able to watch your baby nurse, but if you listen closely, you can also hear your baby sucking and swallowing. If you have any questions or you're not sure if your baby's latching on properly, make sure you talk to a lactation consultant, as often 1 or 2 meetings can really make a difference with long-term breastfeeding success. When you leave the hospital, your doctor's going to want you to come back to her office within a day or 2 to weigh your baby. Now, initially, all babies may lose a little bit of weight, but after a few days and when your breast milk comes in, then your baby will begin gaining weight, about a ½ an ounce to an ounce a day. And this is another way that we know that your baby is drinking enough and getting enough in when you're nursing. It takes about 2 weeks of age for your baby to get all the way back up to her birth weight, but this is something that your pediatrician's going to want to follow closely in the office. In some cases, your pediatrician or lactation consultant may recommend that you pump, not only to see how much you're getting out, but also to help increase your milk supply. The other important thing is that you breastfeed frequently, every 2 to 3 hours, initially around the clock. But once your baby is gaining weight and doing well, then your pediatrician might say you don't have to wake them at night. But during the day, make sure they're feeding every 2 to 3 hours. While you're breastfeeding, it's also important to make sure that you're drinking enough fluids so you don't become dehydrated. And don't forget, a healthy diet is always important, and getting plenty of sleep, which isn't always easy with a new baby. So when she naps, make sure you try to take a nap as well. I'm Dr. Tanya with Mommy Calls.